We are facing a possible COVID-19 surge because of Thanksgiving. Good afternoon, everyone. I'm Kelly Yuckerman. Those are the words coming from the head of the Missouri Hospital Association. KMBC 9's Michael Mahoney says he thinks he has the numbers to back that up.
Holiday travel on Thanksgiving was up in Missouri, despite the warnings to stay home and not risk spreading infections. Up by 40% from that Monday through Thanksgiving Day.
Historically, what we've seen is mobility trends, particularly leading up to holidays, are associated with an increase in case growth.
Now, here's how they got the data. As folks were driving around, mainly on Thanksgiving Day, their cell phones were tracking them. Through the Google COVID-19 Community Mobility setting. The data comes from the location history setting. And Google says it's a setting that people have to turn on to activate. Since the spring, the Hospital Association has been tracking the retail and recreation data daily. And Wednesday, before Thanksgiving, lots of people were going to the store.
The day before Thanksgiving was a day of extremely high mobility, actually the highest that we've seen since the pandemic began.
In Kansas City, mobility increased 31% over that period, 53% in northwest Missouri. But remember, in rural Missouri, distances are often longer for almost everybody, going almost everywhere. If this bears out, COVID infections might start to increase in the next few days. If there's a rise in hospitalizations, it could show up in another week or so. Since, according to the Hospital Association, traveling during Thanksgiving jumps by 40% of what it was before. Michael Mahoney, KMBC 9 News.
Now, getting back to that busy day at stores before Thanksgiving, Reedhead says there is no way to tell who is doing it safely, even as many local stores do require customers to wear a mask while shopping. For now, new cases in Missouri are going down. The 7-day rolling average is down to 3,200. Health officials warned we would see a dramatic drop in these numbers after the Thanksgiving holiday due to businesses being closed, but said it will be followed by a large spike. We'll get an update from Kansas tomorrow. In Missouri, the positivity rate is staying at about 20.3%. In Kansas, the positivity rate remains at 17.1%. Governor Laura Kelly says once a vaccine is approved, the state is expecting to get 150,000 doses by the end of the month. The first shipment will be from Pfizer. Healthcare workers and nursing home residents will get the vaccine first. Now, those vaccines in Kansas will go to local counties. Health department workers, like those in Douglas County, are already planning logistics on who gets those shots first. Investigative reporter Matt Fleener explains how frontline healthcare workers will be first in line.
Tonight, a first look at how a local health department in Kansas plans to distribute the COVID-19 vaccine. Douglas County using this online form, already asking healthcare employers to allow their workers to sign up.
If we don't have healthcare workers because they're exposed and they're suddenly in quarantine, it just makes the system starts to collapse.
Healthcare workers in direct contact with COVID, like those at Lawrence Memorial Hospital, unable to work from home, are first in line under the Kansas distribution plan. Douglas County estimates 6,000 to 8,000 eligible healthcare workers could opt in countywide.
The assumption is that we can get about 6,000 people through, and we won't know for sure what that count will be until we finish the enrollment process.
After enrollment, the plan calls for drive-through vaccinations for 3 weeks, then another 3 weeks for a booster shot.
I mean, it really does feel like our last battle in this pandemic, and I think it's one we're going to win.
As vaccine distribution ramps up, residents in senior care facilities and other essential workers will be next in line. All estimates point to next summer by the time wide distribution is available. Matt Fleener, KMBC 9 News.
Now, the first phase of the vaccine distribution plan doesn't just account for doctors and nurses. It also includes staff like janitors inside hospitals who are in direct contact with COVID. Once a vaccine is approved, 51,000 doses are expected to be shipped out to Missouri. A week later, the state is expecting another shipment from Pfizer and Moderna with 166,000 doses. The goal is to vaccinate all healthcare workers by the end of January. Now, keep these dates in mind. Next Thursday, the FDA will consider Pfizer's application for an emergency use authorization. December 17th, the FDA will consider Moderna's vaccine candidate. So far, success. That's what doctors at the University of Kansas Health System are seeing in a new monoclonal antibody treatment they're giving to some coronavirus patients. They're giving their first doses of Bamlin to patients on high-risk categories. Usually they're 65 or older with health issues outside of COVID.
I'm sure it's disheartening to get that news that you're positive for COVID, but if on that same phone call you hear, but hey, we've got this treatment available, that you qualify for, would you like to come in and get it? And those patients are saying yes, they're all wanting to come in.
Dr. Stephen Stites says a fellow doctor explained that while the drug was being studied, it was not hard to tell the difference between patients receiving a placebo and patients who were getting the real treatment. In Johnson County, Kansas, the health department plans to follow the CDC's new quarantine recommendation. If you have close contact with someone who is COVID positive and you test negative, they recommend 7 full days of quarantine. However, if you fail to go get tested, they still want you to quarantine for 10 days. The county does note high-risk residents in long-term care facilities and prisons are not eligible for this shortened period. People are still urged to monitor for symptoms for a full 14 days after exposure. In Missouri, the Clay County Health Department says it's reviewing the CDC's new recommendation. No decision has been made. For the moment, health leaders are encouraging people to quarantine for 14 days if they have been exposed. The Lawrence School Board is holding a special meeting tonight. It's looking at which criteria it wants to follow when making that decision between allowing students back into classrooms or remaining online. That meeting is at 6:30 tonight. Parents and students can watch it on the district's YouTube page.